How to address secondary trauma in support providers. How can we effectively address secondary trauma in support providers? This is a crucial question, especially for those involved in trauma-informed care and support for individuals with post-traumatic stress disorder. Secondary trauma, often referred to as secondary traumatic stress or vicarious trauma, can affect those who support others facing trauma. It occurs when support providers begin to experience symptoms similar to post-traumatic stress themselves, due to their exposure to the traumatic experiences of others. Understanding secondary trauma is essential. It can manifest through symptoms such as intrusive thoughts, emotional numbness, hypervigilance, and avoidance behaviors. Support providers, especially those with high empathy or unresolved personal trauma, may be at a higher risk. This risk is particularly pronounced for professionals and volunteers who frequently engage with traumatized populations, such as therapists and peer supporters in PTSD communities. Recognizing the signs of secondary trauma early is vital. Symptoms like increased irritability, difficulty sleeping, or feeling overwhelmed can indicate that a support provider is struggling. Addressing these symptoms promptly can prevent burnout and compassion fatigue, which can lead to individuals leaving their roles. To effectively address secondary trauma, a multi-layered approach is recommended. First, individual strategies are key. Self-awareness and education about secondary trauma can help providers recognize its symptoms in themselves. Engaging in therapy, particularly trauma-informed therapies like cognitive behavioral therapy, can provide a safe space to process emotions and develop coping mechanisms. Regular self-care practices, including adequate sleep, nutrition, exercise, and mindfulness, can also help build resilience. Setting healthy emotional and professional boundaries is crucial, allowing providers to know when to step back. Peer and community support plays a significant role as well. Connecting with others who understand the challenges of supporting individuals with PTSD can reduce feelings of isolation. Regular supervision or debriefing sessions can provide a platform for discussing difficult cases and sharing experiences in a supportive environment. Organizational strategies are equally important. Creating trauma-informed workplaces that recognize the risk of secondary trauma is essential. This includes providing training, resources, and policies that prioritize staff well-being. Ensuring access to mental health services for support providers is crucial, as is managing workloads to prevent overload. For those building or participating in PTSD support communities, integrating these strategies can make a significant difference. Normalizing conversations about secondary trauma can help reduce stigma and encourage individuals to seek help. Providing resources such as educational materials and self-assessment tools can empower support providers. Modeling healthy practices and creating support structures, such as peer networks and regular check-ins, can further enhance community well-being. Balancing compassion for others with self-care is vital. Supporting individuals with PTSD is meaningful work, but it carries real risks. Acknowledging these risks and taking proactive steps can protect support providers and ensure the sustainability of the support community. If symptoms of secondary trauma interfere with daily life, work, or relationships, seeking help from a qualified mental health professional is important. Professional guidance can provide personalized strategies and appropriate treatments if needed. Addressing secondary trauma is a shared responsibility among individuals, peers, and organizations. By raising awareness and fostering supportive environments, PTSD support communities can protect their members while continuing to offer vital help to those affected by trauma. Remember, caring for others begins with caring for yourself.